My name is Kate Stratton. My mom, Andra Stratton, co-founded Lipodystrophy United about 12 years ago. And at that point, I was in elementary school. And so I was able to see her advocacy and the impact she made on the community. In the past 4 years, the foundation, Lipodystrophy United, has been pretty quiet. And so I came up to her and I said, your legacy is very important to me and also the patient community, because the patient community is so in need of resources. So I began about 4 months ago as a program coordinator for Lipodystrophy United, and I rebuilt the website, and now I do a lot of support for patients. So I run 2 support groups every week, and our patient group is just expanding. And we're really excited about the impact we can make on the community and also on research and physician knowledge of the disease. So research is pretty scarce. So patients seek kind of knowledge sharing. First of all, just here's what I experienced. Do you experience the same thing? And it's so magical when we can get a group of patients together, because they see another patient and they usually are not able to see face-to-face another patient. Just talking about the experiences that aren't really talked about in research, such as fatigue, severe pain, the hyperphagia element, the severe hunger, things that a lot of times doctors don't validate at all. It's just really nice to share, here's the insurance that covers this drug, or, and then second, just mental health support, because a lot of our patients lack the support and also lack the understanding. Their psychiatrists or other mental health professionals lack understanding of the mood related issues that come from lipodystrophy. So it's great just to have the mental support. Though I'm not a trained medical professional or mental health support, I kind of just provide a space where people can talk about their issues. So those are kind of the 2 main things they're seeking, and through that comes great community. So people now, they call each other during the week, and I have this appointment, I just wanted to share with you. So it's really great to have the connection. Most of our patients are totally spread out. A lot of patients are in very rural areas, then they don't have access to an endocrinologist that knows anything about the disease. They have to travel far distances. So it's really nice to have virtual support. We even have people in our community that Zoom in from Canada and other countries. And so it's really a global community, because the disease is so underdiagnosed, and so there's only a handful of patients that we know about in each region in the US. So the more we find out, the more we can connect people in their area. We are able to provide community, which is something that patients have waited years for. People usually don't get diagnosed that have partial lipodystrophy until possibly their 50s or 60s or even 70s. And so after so long of waiting for a diagnosis and not being believed by their doctors, they finally get a chance to speak with other patients face to face. And that is so important. And a lot of times they just have so much to say, because they have so much that they haven't been able to share with this community in so long. Some issues with diagnosis are that not all bodies look the same. We can have a typical phenotype that doctors kind of look out for, but sometimes patients don't match that phenotype. So for partial lipodystrophy, fat storage might be in other parts of the body than the face and the truncal area that aren't typically seen. So sometimes endocrinologists will just rule out diagnosis because of the way somebody looks, even though they might still have lipodystrophy. They might just not show all the physical features yet. Another issue is that we only have identified 27 genes. And so there could be mutations that are not identified. So endocrinologists will rule out diagnosis entirely if they aren't, if they test negative with the genetic panel. And also, a lot of times endocrinologists don't know what the disease is. And so they test for Cushing's, which is a common, a lot more common disease that has the same phenotype. And they don't have Cushing's, so they kind of just say it's a metabolic complication. So a lot of symptoms of lipodystrophy are not very well understood by someone who has never been able to experience the disease. Fatigue, severe hunger, and pain are kind of common symptoms that everyone experiences. But for patients with lipodystrophy, those experiences are so severe. So it's really important for friends and family members to listen and understand the needs of people with lipodystrophy. I would like physicians to know that pain and severe hunger and severe fatigue and mood issues are very real for the community. And a lot of times physicians suggest that people change their lifestyle and everything will get better. But those are the issues that are common to everyone with the disease. Even when patients are able to go on metronidazole, they still have those issues. So just knowing that patients are still struggling and we need more resources. And we also want physicians to connect their patients with Lipodystrophy United so they can get the psychosocial support that's very needed as well as the care. So there are multiple clinical trials right now. One was just ended, but we do have a partial lipodystrophy metronidazole clinical trial that patients can get involved in. Research for the past few years, there hasn't been that much because the patient advocacy organization, Lipodystrophy United, has kind of been quiet, so we haven't been constantly advocating for new research. So we really need more research into the aspects of the disease that are not as known by endocrinologists, such as the pain aspect.